Hi, my name is Cassandra, and I did my research study on the effectiveness of putty as an alternative for skin picking in a child with autism or autistic child. My research question was, will introducing an alternative like putty decrease self-injurious behavior? The participant for the study is or was a 6-year-old female diagnosed with autism spectrum disorder, who is currently enrolled in a special education program, which includes other neurodivergent students from the ages of 5 to 9 years. The presence of excoriation in her life has become an alarming issue as she's beginning to develop scar tissue on her arms, hands, and fingers. Not only is this a medical necessity at this point to decrease the chance of infections and scar tissue, but also for her to be part of society and have the ability to socialize and make requests without being overstimulated or turn to skin picking. Going into the method design, you will see that I used a multiple baseline design, as you can see on the screen, and this included setting A, setting B, setting C, which was school, mom's house, and dad's house. Baseline was recorded for several hours in each setting on a 5-minute partial interval sheet, and then transferred over to Excel to make a graph shown like the one shown on the screen. And the putty was successfully a preferred item after being implemented during the intervention phase. It was first implemented or introduced during setting A in school as just a playful item. I modeled how to appropriately and effectively and playfully use the putty. And then I did it the Rosemary was engaged with me. We did it together. We played with the putty together. And then she was given time to use the putty on her own. If you look over at the graph, you can see that there was a decrease in skin picking for each setting after the intervention phase was introduced or started. And if you take a closer look, you'll see that there was at least a 30% decrease in skin picking for each setting. An important factor to know about the reoccurring SIB is that it did occur throughout the day, regardless of the demands. And when I was recording baseline, I was there for several hours during the school and a few hours in home, so dad's home and mom's home. And I noticed that the skin picking was occurring at random times, anytime where there was a lot of noise or interaction, or even sometimes just simply walking to get something in the kitchen and there were people there. So then I look back on the data, the 5-minute partial interval sheets, and realize that this was occurring in times of social, when we were in social environments or engaging with other students, as opposed to just being in the isolated room. So this being said, it appears to be pointing more towards a way of self-soothing and decreasing overstimulation rather than my initial research question, which implied that it was mainly during when she was making requests. Results indicated that the implementation of the intervention was successful in decreasing skin picking. However, for future research, taking a closer look at the environment and how it affects the participant and comparing the noise level and interaction levels definitely had a significant role in the presence of SIB. And looking deeper into that and finding ways, not only alternatives, but ways to slowly engage the participant or the individual in social environments, like taking baby steps like 1 peer or 2 peers or being in a full classroom. Those steps need to be taken in moderation and slowly in order to ensure that it is an effective environment for the participant. So especially during instructional time, making sure that instructional time can be implemented by taking necessary steps to make sure that the environment isn't overstimulating. So looking back at the discussion portion right here, on the slide, I also noted two limitations that need to be taken into consideration was that scheduled times were not always met. So there was inconsistencies with implementing the putty due to the participant being sick or simply a no-show or late notice cancellations. The other would be, as I mentioned, was the overall noise level and interruptions that were reoccurring in the household. If this study was to be administered again, a clinical setting would be more effective to ensure that the isolated rooms are quiet and sessions are productive for the beginning phases of intervention. Looking back on the study, I'd say that one of the biggest things that I learned is that you can't control the environment or the setting that you're in, even if you plan it to a T and specifically and very detailed for the participant. Also, that there will be outside factors and limitations and obstacles to overcome and to work around to ensure that the best course of treatment and intervention is being implemented, as well as making sure that there is more of an effort being made to discuss treatment and intervention plans with the teacher and the paras, as well as the parents, and having everyone come together and really understanding that this intervention needs to be consistent and we need to stick to it in order to really see significant changes. Thank you all so much for viewing my presentation.